For the Society of Gynecologic Oncology and Foundation for Gynecologic Oncology, 2012 was a transformative year for an organization dedicated to the eradication of women's cancer. And in 2013, there is no end to the possibilities of what the SGO and Foundation can accomplish. In 2012, the Society of Gynecologic Oncology, a 501c3 organization, restructured so that the Society became a 501c6 organization, and the C3 was renamed the Foundation for Gynecologic Oncology.
We've been able to blossom now with this new infrastructure to be able to develop programming that can, again, help our members become as knowledgeable as they can about gynecologic cancer, and then be able to take that knowledge and transform it into their practices so that they can deliver that high-quality, cost-effective cancer care to the patients affected by gynecologic malignancies.
With this restructuring, SGO is now in a position to better advocate for gynecologic cancer patients. With member groups like the SGO Clinical Trial Endpoint Task Force.
As the premier organization for stewarding the care of women with gynecologic malignancies, it's important that we participate in the dialogue and lead the dialogue on clinical trial design.
In this new environment of advocacy, education, and research, the Foundation for Gynecologic Oncology established the Outcomes Research Institute.
The Research Institute was a product of that forward-thinking vision of the Foundation to develop a collaborative model whereby the membership would have ownership of these very important research initiatives that address these important areas in women's cancer research.
Another important accomplishment for the SGO in 2012 was the Practice Summit that generated an SGO white paper on creating a new paradigm in gynecologic cancer care. Policy proposals for delivery, quality, and reimbursement.
The purpose of the Practice Summit was really to look at how do we define delivering high-quality GYN cancer care, and in doing so, how can we be effectively reimbursed as we move forward with newer healthcare reform models.
This year, the news media continue to turn to SGO for members to share their expertise on women's cancers.
We've had some really good placements this year. Dr. Nauman was on CNN, Dr. Parker was on Wall Street Journal Radio, and Dr. Singh was on the Dr. Oz show. These are all really big public places for our members to appear, and it really raised the visibility of the society.
Part of representing the best in gynecologic cancer care is making information like clinical practice guidelines, educational courses, and patient resources like the Survivorship Toolkit even more accessible through the new SGO.org website.
We're very excited about the new SGO website. It's a fresh look for the Society and the Foundation.
In Chicago, the SGO staff brings a breadth and depth of expertise in support of the diverse activities of the Society and Foundation for Gynecologic Oncology.
We have an amazing team of people who work hard every day at allowing both the SGO and the Foundation to fulfill their missions and visions.
This past year, for the first time, SGO conducted open elections, giving members a more direct influence on who will be leading the Society.
It was very encouraging to me to see that the highest percentage of people who wanted to participate were the fellow and the candidate members, and I think that just bodes well for the future.
Across the membership categories, there has been increased growth and participation in SGO committees.
We had 16% new members, 212 new members, which is better than usual for us, and it's a great credit to really our great recruitment efforts and the efforts of our staff and our expanded membership, which is now more inclusive.
I think one of the biggest accomplishments of the Allied Health Group this year is really membership growth. I think it's one of the things that I'm the most proud of as a group, that we are reaching out to nurses, to clinical nurse specialists, to physician assistants, to nurse practitioners, and really developing a community to which connect with each other.
SGO members have taken advantage of the Society's educational offerings, like the convenient and cost-effective e-learning offered by SGO ConnectEd. As SGO celebrates the accomplishments of the last year and looks towards the future, there is much to be proud of and even more to look forward to in the coming year.
Really excited to work with Dr. Goff over the course of the next year. She brings a tremendous amount of energy. She's very motivated, committed, and will really continue to strive to bring both organizations strategic and moving forward, like many of the past presidents have done in the past.
I have truly enjoyed being the SGO president this year, but to be frank, it's really a team of leaders, and we have a fantastic group of officers and board members, as well as committee chairs and co-chairs and committee members. No one person runs the Society of GYN Oncology. It's a great team effort, and I've gotten to know so many people so much better in working with SGO during this year. And I can truly tell you that SGO is in great hands for the future. We have a number of great leaders that are developing within SGO who will lead us to only greater things in the future.